Hello,
Hello.
hello.
My hair always
Ha-
looks so normal in real life, and then on camera it always looks crazy. So I want to study it and figure out why.
Can I ask you a personal question?
Yeah, I'm scared, but yeah.
Is that a trigger for you? Just because I know previously like hair was a trigger for you in your journey.
Oh, I forgot my light. Let me put on. Everybody's gonna see the behind the scenes. Oh my God, my hair was such a trigger for my body dysmorphic disorder. That was like my worst, and it had to be perfect. And let me tell you, if this would have been back when my BDD was really bad, I actually wouldn't. I would probably spend like 3 hours before coming on camera. I literally spent like 5 minutes today. But what's just crazy is I look in the mirror and it looks normal, and then you go on camera and it's like, and
Yeah.
so,
No, I think it looks great, but I'm just
oh,
saying
thank
like
you.
what isn't it so cool to be able to be at a place where you're like you can still have flexibility with yourself and be like, oh, it looks different than what I expected, but like here we are and like let's go. And I would just love for you to share a little bit, Chris, of like, because I think it's good for people to hear from us too, of like what does that experience feel like for you of going from like, oh, in the past I would have been stuck for 3 hours where now I'm able to have flexibility in it and whatever it means.
Yeah, I'm glad you asked because I think, I think of some of the things that you and I have really tried to push the last couple years, whether it's on the live streams or whether it's in the conferences. And I think it just comes from our lived experience, and that you have been somebody that's really championed that people don't have to live with just suffering, right? Like you're suffering better than you did before treatment. And I'm telling y'all, like treatment works. Before I became a therapist, like really became a therapist, I was working in the entertainment field and I was on camera. And I mean, if I had to be on camera at noon, I was getting ready at 6 in the morning. I'd be in the mirror fixing the perfect hair, constantly checking the mirror. And it would frustrate, the staff because the makeup girl would be like, I just put powder on you, you're not shiny. Or the hair people was like, we sprayed so much hairspray, it's not going to move. And it wasn't just that, it was pictures with family, it was looking on camera, etc. And so today, I mean, it's not a very exciting story, but something happened at my apartment, so I couldn't get here as early as I normally do. So I like just ran through the office door, put my hands through my hair, put on my jacket, I was like, let's go. That would have been, I would have called out. I wouldn't have shown up. And so I think, treatment has you trust yourself. Treatment has you believe in yourself. It has you connect with things that matter. And being on this live stream today is way more important than my hair. And I know it's hard sometimes with BDD because people think it's like a vanity thing about appearance. It's not. It's really just feeling like things are off, things are difficult. And similar to OCD, your brain is just beating in your head. Your hair doesn't look okay. What are you doing? Nobody's listening. They're staring at your hair. So I just always think that. And I don't know if you feel this way, Liz, but I always am so excited, in San Francisco, I mean, at the conference, right? There were so many times I was sitting there like, man, I remember that first conference. I couldn't do what I'm doing right now. I remember having to sit in the chairs at the conference, the one that I first saw you at. And I remember having to go into the bathroom, taking like paper towels with soap, a dry paper towel, rubbing it, drying it for the contamination. I had to sit in the back corner because of my health stuff. So I didn't want people to be around me and like give me a disease. So it's just, you constantly see those. I mean, is there something you think about like, or you noticed either today or like recently where you're just like, man, I'm proud of myself. Like this would have been so hard to do years ago.
It's funny, like for me, it's not needing to like shower or wash my hair in this OCD way. And y'all are gonna be like, well, that's weird. But I legit mean it that like I think that I think that in the past I could not get up in the morning and get out of the house without showering. And now, like if I'm running late, sometimes guess what? Like I don't shower. Like yes, this morning I had time, but like there's flexibility in that, right? That sometimes like, okay, I'll shower later, or like I'll wash my hair later, or it's not this rigid, like I have to do this a certain way. And it's funny because my family doesn't have OCD, but 100% my mom and sister are very rigid about like, if you don't shower in the morning, that's gross. And then it's funny because I know people are like, if you don't shower at night, that's gross, right? So it's like, it's for me being able to laugh at like, oh, like I don't think either is gross. One is just different, or it's right. Like the flexibility for me, and I notice it in so many ways, but I think the shower is the biggest thing for me, especially with kids, is like, we'll see what happens today and what time I wake up and if there's enough time to shower or if there isn't, and figure that out. And so, I think overall, that's the one thing I've been talking a lot about with treatment is like flexibility is what we're going for, right? Like for you to be able to like be flexible and right versus rigid, it shows up in so many areas once we start to live our life in a flexible, non-rigid OCD way.
I think of it too as like, I've been trying to be more and more open about all my subtypes, because I think that we don't always talk about some of the more taboo. And I had a lot of intrusive sexual thoughts around family on my mom's side, and then I had a lot of harm thoughts on my dad's side. And my birthday was months ago, but because of the traveling and the conference and everything, we haven't been able to celebrate. So we're going to celebrate both next weekend, one with my mom's side, one with my dad's. And it's funny because like I'm super looking forward to it. Like my Greek side, we're gonna have Greek food, we're gonna play games, and it's gonna be my aunts, and it's gonna be my mom and everything, my sister, her husband. And then on my dad's side, my grandma and my little sister were the big triggers of my harm OCD. And it's like I'm on the group chats like, come on, I'm excited, I can't wait to bring it, we're sending pictures, like we're all hyped. Where I remember back, during treatment and before I got better, it was like I dreaded for months Thanksgiving, Christmas, birthdays, because I was like, great, I have to see my family. All I'm going to do sit there is think, have internal sensations and have thoughts about, fighting back and forth, trying to convince my brain that I don't want to have sexual contact with family. Or on the opposite side, when I would be with my dad's side, the whole time I'm like sitting on the couch, holding the couch handles and being like, okay, I can't be alone in the room with them. So if it was just my grandma and my sister, I went to the bathroom, or I went downstairs, or I went somewhere else. I was never alone with them. Or I'd hold the couch because it was like, as long as I hold the couch, I can't hurt them. So I just think like I'm actually like looking forward to it, next weekend. So I always think about that. It's just like how much hard work that we both put in, not just us, but obviously so many others that have gotten better, and it always pays off.
Yeah, no, it really does.
And
I think the thing I always tell people is that one of the greatest blessings in life to me is when you can have gratitude for things that aren't big, like and I really believe that like OCD treatment really gives you that, just because most people aren't grateful that they can take a fast shower, or that they can wear whatever clothes they want in their closet, or that they can be around their family members, right? Like, yes, you're grateful for the connection, but most people aren't like afraid to do these things, or there's not, right? And for me, like the things that make me happy, it's not like, did I get a bonus at work? It's like, wow, I could like get dressed and wear whatever I wanted and it not be dictated by rules, and it be dictated instead by me and by flexibility. Like that is where my gratitude comes in. And I think there's such like a little blessing in that for all of us,
Yeah. And I mean, that's why I do it. I mean, I think if people don't know your backstory, if they don't know my backstory, I mean, we do so much volunteer stuff for this community, and it's not for selfish reasons. It's because I have clients that come in, or I see people at the conference, or we get social media or email messages, and it breaks my heart. People are like, I haven't left my house in 3 years, or I had to give up custody of my child because I'm afraid I'm going to hurt her, or I was so into my faith. I was doing all these, Saturday and Sunday classes to get really involved in my church, and now I can't even go to church. And I think that's what's so insidious about this disorder is like everything we care about and everything that makes us who we are, the things that make Liz, Liz, or the things that make Ethan, Ethan, et cetera, Val, Val, right? Like OCD strips us of that, and you really become a shell of yourself. And so I think one of the things that we really tried to push at the conference during a talk that you and I did with John Hirschfield, who's open to coming on the stream again to talk in little depth, is the treatment is something that I embraced so much. I know you've embraced it, Liz, et cetera, because to me, it wasn't like I'm going in a room and doing things I hate. To me, it was like I'm fighting to get my life back. And I look at you, I'm still moved from your keynote that you did for OCD SoCal a couple of years ago, like not thinking you could be a mom to now being a mom of two. I just think that stuff like that is just so good hope. And I always want to put those stories out. I mean, I think any of the people out there watching right now that want to be parents and think you can't, I hear a lot, like I'm going to harm my child, or I'm going to give my child OCD. I think looking at Liz's story and her to be able to come full circle, get married, have 2 children and raise them, I think that that's the kind of stories we want to hear. So excited for Ethan and Katie. They're getting married later this year. And I know they've talked about never thinking they could get married. So I just think all of those kind of stories, I hope the community continues to hear those, because I hope those stories are louder than the other stories that people hear of suffering and things like that. Not that I don't think people can validate their experience, but we also have to let people know that you can turn your life around and just have it be amazing.
100%. Yeah. It's good for us to have these reminders and to just think about the way that like, oh yeah, like, and to also not over pathologize, like, oh, Chris, you can't be, it's interesting because I do want to talk about this for a second. And then of course you guys, I promise we'll get to our live stream. But I feel like some people would be like, well, Chris, like by you saying that you were like that you know, by even making the comment that like, oh, my hair doesn't look the way I want. Like people, like I think some people would say, oh, you can't say that. Or like, you can't, you know, no, like you have to lean into that. And like, maybe it does look bad. And it's like, wait a second. No, like that's not my OCD anymore. Like I legit am just saying it looks different. And so can you talk about that for a second of like, how when you're in recovery can you also practice flexibility of not being rigid that like everything we think or say has to be like fought with this uncertainty model or ERP?
I'm so glad you said that. I was actually having a conversation with a good friend of ours that I talked to you about wanting to do a live stream with them as well. But that's what I was talking about. I think sometimes people don't think that ERP, and then I know a lot of people know ACT and people know DBT skills, et cetera, but I always feel like ERP should be the base. And I feel that people think that they have to, you know, we did a talk at a conference about not having to accept worst case, but I think there's a difference between starting treatment and where Liz, myself, Val, Tommy, Ethan are, et cetera. I don't sit there and have to lean into maybe or maybe not. I can see my hair now. I think my hair is fine. It's just, it was shocking for a second because it was big. Or I can acknowledge that the thing is like texting in the group chat, you know, about harm thoughts and about sexual intrusive thoughts. I don't have a thought and I don't have a feeling. I just reminisce sometimes of how proud I am of myself. I am very confident and I trust myself, and I'm very clear that no part of myself wants to hurt my family. No part of myself is sexually attracted to family. I know I'm not going to get cancer because a fan is blowing on me. I used to think it was, and I have a fan on me right now. Like, I trust myself. I am extremely clear. And I think that's something that I see sometimes is people think that you can't have aha moments with ERP. You can't feel like you don't have OCD at times with ERP, and that you don't have these trusting moments. I trust myself 100%. I didn't trust myself in the beginning of treatment, and I had to learn to address my thoughts differently. And I also do embrace uncertainty and doubt and not knowing. I mean, I'm going on my first international trip ever to MC my friend's wedding in Italy in early October. I've never traveled with a passport because of my OCD. There's some things I don't know what's going to happen. I hope my luggage doesn't get lost, but I trust I'll figure it out. If the luggage gets lost, I'll be pissed. And then I'll have to go buy some really cool Italian clothes or like borrow from my friends, and I'll figure it out, right? So I think what you were saying is the conversation I was having this morning, and actually I was thinking about it while I was walking down the stairs to come here. I feel like we trust ourselves. I feel like I don't have to lean into uncertainty about things I now know, and things that I don't 100% know, like my packaging getting lost. I know there's certain things I can do, and I know there's certain things I have to let go, and there's a little bit of risk anytime we travel. So I am very clear on who I am. I'm very clear on my identity. I know what I want or what I don't want, and I know what things I can control and what I can't. So there's not this like ERP, you have to never know anything. Of course you do. Maybe not in the beginning, but that's part of the treatment, is to get to a point where you start to learn so much from the treatment that you do.
Do you think, I mean, I'm not going to like, Allegra's probably super busy right now, so I'm not going to be like, Chris, can you get Allegra on this live stream? But I actually kind of want you to. Just like, I'm curious if she'd be free, but I would love to talk about her post that she made, because I loved it so much last night, and I was just like, oh my gosh, I want Allegra to come on and talk about this. But I love this statement, and so I'm just going to read it. And maybe we can ask her if she is free, but like we can definitely plan to do another. So those of you who don't know, her name's Allegra Castens, and she has an amazing Instagram and social media following, and is an incredible advocate, clinician, but also lived experience, I believe, with OCD. I'm correct on that, right, Chris?
Yeah.
Okay, I'm like, please, like, confirm me, right? But I want to read this post. So Allegra put a post that said, telling people that they will never get to know the truth about something their OCD has latched onto is often inaccurate and can be a form of gaslighting. Human beings are capable of knowing their sexuality if they are a serial killer, if they're a P3DO, or attracted to family members, if they hit a car and ran, etc. This goes for people with and without OCD. If people without OCD get to know these things, so do people with OCD. I know what you might be thinking. I live with a doubting disorder, so there's no way I can know that. Well, effective OCD treatment should help you understand the process and reasoning that keeps you brought into the doubt, so that you don't keep fueling the doubt with compulsions. And I loved this post. And so I want to have Allegra on, and we can have a whole thing about it. And so I'm just calling out how incredible of a post this was, because The misconception that Chris is talking about, you guys, that so many people live in is that if I do OCD treatment, I will never know where I stand. I will never be confident in myself. I will never be able to know if a fan is dangerous, if I can eat this food, if I can drive by this house, if I can be around my family member and be safe. Like, that is the biggest misconception and myth. And it is so damaging for people with OCD to think that, like, okay, I have to accept that I'm never going to know these things that terrify the shit out of me. Sorry, you guys, for cussing on the live stream. But, right, like, we did a talk kind of on this a little bit different, right? Remember, Chris, me, Callie, and I think Emily Bailey, but it was about, do you have to accept the worst case scenario as truth? And the answer to that is definitely no. Like, if we have a fear of being a pedophile, we don't have to accept that we are a pedophile. Like, we definitely don't need to accept that. But also, like, we don't have, OCD treatment might mean, and I do want to agree with this, that we have to lean into the uncertainty or the unknown while we're doing treatment. But as somebody who has lived with pedophilia, OCD, with all sorts of sexual intrusive thoughts, harm thoughts, you name it, I can now tell you that I am confident I'm not a pedophile. I know that I'm not a pedophile. I feel strong about that. I feel confident in that. And that treatment is going to get you there. You do not have to do treatment. Doesn't mean you have to accept that you might not, that you're going to never know if you're a pedophile for the rest of your life. If I told you, Chris, that, like, oh yeah, you have a fear of pedophilia, well, come do OCD treatment with me and you're going to get to learn how to live forever with the fact that you might be a pedophile, would you be like, yes, sign me up, sounds good, let's do it?
No, and that's what's so crazy is that's not even what my therapist did. Like, my therapist never sat down and said, you're never going to not know if you're going to hurt your family, and you're never going to not know if you want to sexually are attracted to family. And one thing she said to me, which I tell all my clients, is I say, look, the reason I can't give you reassurance is I just met you. I'm assuming you won't do those things because you're here, but I don't know. But one thing I can promise you is we can squeeze the OCD out of the situation. And once the OCD is out of the situation, now it's just you and yourself, and you will get clear on the answer, but you're never going to get clear if you continue to give into OCD.
Yeah. And I think it's just, so hopefully Allegra will join us and we'll reach out and ask her. Cause I think that, like, this topic and so many others, but it is just so important for us to think about. And I loved when she's like, OCD is gaslighting you. It's like, yeah, it is. Like, it is making you believe, and treatment like that, like, don't gaslight yourself to believe that, like, you have to, I don't know the definition of gaslighting, so I need to read it, you know, but to be
it's
able
where
to
somebody kind of like it would be like me telling you, like, Liz, every time we talk, you're so mean to, like, it's basically making you, like, you feel crazy, like you're the one doing something wrong. And typically we see it in domestic violence, and the abuser is the one gaslighting the person that's the victim. It's trying to make the victim think that they're the bad person when it's not them at all.
Yeah. And so the question is like, is your OCD abusing you, and are you letting it, right? Like, are you letting it believe that, like, the best I'm going to get is, like, feeling awful about this forever? Right? Like that's like, am I, or do I believe that with treatment, I can actually have freedom from this? And freedom also doesn't just mean I'm not worried about it. It also means what Chris talked about, which is that we are confident in who we are and what we want, in the decisions we make, in the life we're going to choose to go live.
Yeah, can I add something to that? Because as you were talking, like, the way I like that you clarified, like, during treatment, you will have some uncertainty. And so this is how I explain it to people. And I'll use myself as an example so I don't have to talk about somebody else's OCD. But if I was working with myself, and let's say I was having these intrusive harm thoughts around my youngest sister and my grandma, I'm not going to tell me as a client, well, you could be somebody that hurts them. What I tell them instead is, like, okay, you have a lot of intrusive thoughts, and it's more than thoughts. It's feelings, it's guilt, it's shame, it's sensations that you're experiencing that you don't want. That's why you're here. So we know that this is the opposite of something you want, because people don't come to therapy to talk about how great something is. They come to talk about something that's difficult. So you're experiencing these thoughts and these feelings, correct. Well, what you're doing is you're like a cold case detective. You have a little bit of evidence that OCD's given you, and you are just rehashing that same evidence. And for me, it was like years, right? So you're looking at the same evidence over and over. Well, no cold case detective would do that. They would only open the case if they got new information. That's why it's called rumination. Rumination disorder, I've explained this on the live before. If you look it up, it's a food-based disorder where usually kids will chew up food, spit it out, re-chew it, spit it out, re-chew it. And that's what we're doing with our thoughts. So what I tell clients is it's going to feel so bad to walk away from the fact finding, the researching, the Googling, the looking things up, the reassurance and the checking. And you're going to feel uncertain for a while because your compulsions made you feel a temporary sense of relief. And we're asking you to give that up, but not for life, for a very temporary period. We're going to learn how to get to a point that everybody else handles these kind of thoughts and feelings because you're handling it right now completely like somebody with OCD. And so why I was doing the treatment around my harm, sure, there was times I felt uncertain because normally I would research something. I would look up things about hormones and about snapping and hurting people. Is that a thing? So temporarily while I was doing treatment, I had to walk away from fact finding. So I lived in that doubt and uncertainty because it was the first time I didn't try to answer that question. Am I going to hurt my family? But what happened when I walked away, when I stopped mentally giving into it, physically giving into it, etc., I noticed that it became less and less prevalent. And then as it kind of dissipated, my therapist and I didn't say, okay, let's live with uncertainty forever. She's like, talk to me. Now that you're not doing compulsions, you're not engaging, how do you genuinely feel as a person? And I was like, dude, I am the most protective, like Greek family member in the world. If somebody was to hurt my grandma, my sister's like, I'm jumping through doors, I'm kicking people, I'm punching. It blows my mind that OCD was able to convince me for a while that I would hurt them when actually I would defend them to the ends of the earth. I'm saying this straight up. I would rather die before my family died. Like that's how like protective I am. And I cannot believe for a while OCD flipped me on the head and said I was the person that was wrong. It was OCD that whole time. And so my therapist and I didn't talk about it anymore because I was really clear that I would never hurt them. And when I left treatment, I didn't suddenly still think I did. I really left treatment clear that I loved them. And the reason OCD picked them is because it was something I cared about. So I was willing to fight. So I didn't live in uncertainty forever. But yes, it did feel like that temporary when I wasn't looking things up. But I will tell you, all the research I did never gave me an answer either.
Yeah, that's the thing, right? And I tell people, it's like, well, I need to know for sure. Like, the more you give into OCD, you get more stuck, you get more confused. But treatment actually does give you clarity. And I remember when I said this once, someone was like, what? And they're like, but we're not supposed to be searching for certainty. And I was like, wait a second. Like, we're not searching for OCD certainty, but treatment should still allow you to have clarity, to have confidence, to be able to know that, like, this is who you are. And that when we lean into the discomfort and we try to not run from it or fix it, we actually do obtain clarity, right? Like we clinically, what clinicians call this is insight, right? Your insight increases as you engage in treatment. But when you first start treatment, most people's insight around their OCD is pretty darn poor. So really important.
I love that word that you use, clarity. I love that word because I think most people are clear. And I think that we get to a point of clear. Now, I think there's some things you can be more clear on with OCD than other things. Like, for instance, I'm much more clear that I'd never harm my family. And I'm a lot less clear that if I left stoves or something on, that wasn't a big part of my OCD, my checking, but it was something that I did do. Or a bigger one, okay, was like locking my doors when I left the car. If I had to say life or death, would I hurt my family? I could stare you in the eyes and say, I will bet my life I'll never hurt them. If I had to say life or death right now, did I lock my doors? I sometimes rush and forget, but I trust that I did because I probably did. And if I didn't and some god awful things happened, just like everybody else who has had their car broken into, I will figure it out. It'll be inconvenient and I'll hate it, but I trust that I will overcome that. So that's what I always think about is like, most people don't have 100% clarity if they lock their door. They'll say they're probably more likely that they did it, but you don't need to be 100% certain about those things because you trust yourself to be able to handle those. But the taboo stuff and things like that, I don't want you to hear from Liz and I that we're saying go out there and research and get reassurance to get clarity. No. We're saying you got to do the hard work that both of us did that really, really worked for us. But I don't want you to think for the rest of your life, you're 87 and still doubting something. I don't doubt it. And my treatment was not 87 years ago. Like, I'm very clear who I am and very clear on where I'm at. So I really am passionate about this treatment. Love Allegra, was texting her last night. I think it would be good to get her on like a lunch and learn where we could spend the whole time talking. So yeah. I'll definitely reach out. Our next month's Lunch and Learn is actually coming earlier because the Research Roundtable had to switch with us. So we don't have to wait like a month. We could get it in a couple weeks. But I love that you brought up this topic, and I love your conversation about it. And I think that's why you can have kids, is because you're at a point with your treatment that you're not still doubting if you're going to harm your children. You're very clear that you love them.
Totally. Yeah. And I'm clear because I've done the work, right? So I want to be clear that like the clarity doesn't come first. A lot of people with OCD want the clarity to come first. Like, okay, I want to be sure, and then I'll go do the ERP. And it's like, well, that's not going to come first. We actually have to do ERP first. So ERP allows us to have the clarity. So it's kind of that thought process of like, change your behavior first, and then the clarity will come, versus most of us want the clarity to come first to be willing to change our behavior. And that's why we stay stuck in that vicious OCD cycle. But thank y'all
real
for
quick, if I could add one last
stream.
thing to what you just said. You keep saying good things, so stop saying good things and I won't have to comment. What you said is so important. One of the things that I learned in one of my first trainings with the IOCDF, I forget who ran it. I think it was Alec Pollard. It wasn't a BTTI, but there was like a training I went to. And one of the things that they said is just what you said, is we want that clarity so first before we do things. That's not what average people do. There's people that don't get clarity that they'll be 100% safe jumping out of a plane. We know that jumping out of a plane, there's some risk, but they do it anyways. And we got to be willing to do that. With OCD, we want certainty, and we don't do spontaneous things. People with OCD overthink things. So we have to be open and willing to be spontaneous. No, none of us clinicians should be asking you to do things that are unsafe or immoral, but we're going to ask you to do things that you might not feel 100% ready. But one thing I remember, and I'm going to give credit to Alec Pollard, even if it wasn't him, is he said what's so great about the treatment is we change from experiences. Yes, the cognitive part of CBT and ERP is important, but experiences change us. And I know for me, like with BDD, walking around, it was the first time I was ever in public with my therapist. That experience changed me for life, because none of the belief systems that I held were validated. Or the first time that my therapist and I went and ate food with my hand, because I never ate food with my hands, it was like that was a life-changing experience. So I do think there's all different tools that therapists that are constantly in the game are learning, and those experiences that we have when we do something different mentally and behaviorally, that's where the change comes from.
Yeah, no, this is exactly right. And I think that it's just, so such important topics, and we can keep going and going, and it might not be so useful. So
I'm going to throw the first questions at you, because these were the questions that we had, the only ones we didn't get to last time, and somebody actually private messaged me and asked me if we were going to get to their question. So I'm going to put it
before we do, I am going to say hi. Welcome to our live stream. We love to see y'all. We just got on our own tangent because this is who we are. So sorry, but welcome. Remember, these live streams are intended for educational purposes. They are not intended to replace therapy. And of course, IOCDF is not a crisis line. If you're feeling unsafe or suicidal, we want you to go to your local emergency room, call 911, or now you can call 988 as a suicide prevention line. Of course, remember that we do our best to provide content and education that we hope is helpful, but our opinions are our own opinions. They're not necessarily a reflection of the foundation. Please make sure you go to iocdf.org/peace of mind to learn more about upcoming live streams, events, stuff that we're doing, you name it. This is also the place that you can see a calendar and a schedule of all of our upcoming events, but it's also where you can submit questions or topics that you would love for us to cover. And we absolutely do our best to tailor what we're doing, what we're talking about, guests that we're bringing on, to be based on your feedback and what you guys want. We love this community and are so grateful for the foundation and for you guys. And so our goal is that these live streams will continue to really be able to be informational and educational, but most importantly, that they will meet you guys where you are right now and with what you want. So please give us feedback. All right, Chris, we can hop into questions, but we kind of 30 minutes in, here we are. Welcome. We're just starting. So
I mean, I hope people got a lot from that conversation. Remember, these live streams are for you. Today, we are doing a Ask the Experts. I know it says Lunch and Learn and stuff, because normally we do a Lunch and Learn this week, but because we were at the conference and we were like, everybody's like settling in and stuff. So please throw questions in the chat. We have a bunch that we didn't get to last week, so we'll get to that. But please shoot us your questions, any questions that you have. So I'm going to start with some that we didn't get to last week. So I put them in the private chat so that Brennan can put them up on the screen. But the first one says, any advice on thought replacement? Whenever I get a bad thought, I have to replace it with a good thought, or even if I hear someone say something bad, I have to wait for them to say something good. It can take a while and leave me feeling paralyzed until the person who said the bad thing says something good. So it's kind of a two-part, like thought replacement, replace bad with good, and then having somebody have to like say something good after saying something bad.
Totally. So a couple thoughts. The first is that I really want us to change our language a little bit so that we can understand that we actually don't have to do these things, and that we have the power to change the way this makes us feel. So I would actually say any advice on thought replacement, whenever I get a bad thought, I choose to replace it with a good thought. Or if I hear someone say something bad, I choose to wait for them to say something good. It takes a while and leaves me feeling paralyzed until the person who said the bad thought might say something good. The reason I want us to really be thoughtful about the word choice is that I want us to have recognition that we are still choosing to respond to OCD versus our life. And so this is a great question, and this is a great opportunity for us to discuss ERP. So what do we want you to do? We want you to no longer try to search for the good feeling. We want you to no longer attempt to feel good or wait until you feel good. And so instead, what we want you to do is we want you to be able to do ERP in this moment. So I'm with Chris. Chris, I have a bad thought. I am going to let that bad thought be there, acknowledge it, and choose to keep having my conversation with Chris. Let the feelings and thoughts that, what if that means something bad? What if something happens? Whatever the fears are, like allow them to be there, but choose to not figure it out, solve it, or replace it with a good thought. Instead, I want to purposely, when that bad thought is there, choose to do the opposite of what my OCD wants and move on. If I'm with Chris and Chris says something bad, he says something negative and it gives me anxiety, and I feel the need to sit there and wait until Chris says something good. Instead, I want to purposely actually in that conversation or walk away on a bad, uncomfortable note and lean into like who knows what that means and move on, right? So allow yourself to face the fears, to face bad thoughts happening, people saying things that aren't great, and not give in to the need or desire to fix it, right? That's the trap, the OCD trap, that it's pulling you in, and you have to decide, am I answering to OCD here or not?
And I just want to because Liz was thorough, I just want to add one little thing, is that feeling good, right? Like replacing it with a good thought or waiting for someone to say something good. I want you to take away that it's like a feeling of relief, because I think of relief as like getting a back massage on, with hot stones on the beach, right? What it really is OCD caused the problem in the first place because it's giving you rules that you have to replace good thoughts with bad ones, or bad thoughts with good ones, or have somebody say something good before you can go. So it's kind of causing the problem, and then you do it. And more so what it is you just get to go from being dysregulated to regulated temporarily. But now what you've done is you've empowered the OCD, and now you're stuck doing it for a long time. So I always want my clients and everybody watching to say, look, you got to be bold for a couple weeks. The cool thing is with OCD, stuff like this, especially when there's not this like long kind of history of it and stuff, it's more just like a feeling versus like, I really think I'm a bad person or something. If you just really hit it for a couple weeks in a row, that sacrifice that you make for a short time, you're going to get relief. I didn't have that OCD, but if I thought a bad thought about someone, I thought karma. I was more like moral screw, and I would have to like say good things about him to replace. I don't do that anymore. It is so nice to not have to do that, because let me tell you, it is exhausting. So remind yourself a short change will cause a lot of gain. Cool. So the second question is, what is the best tip for getting over real event OCD that has you constantly replaying and reviewing shameful mistakes that fill you with guilt and self-loathing?
First and foremost, I think this is a really important topic, and one that I've been talking a lot about clinically is like, how do we address OCD when OCD is here, but then also shame and guilt and all these other secondary emotions and feelings are here? Because we don't want to just address OCD and not address the way that we treat ourselves, or our ability to not, give ourselves grace or engage in values-based activities or do these things that would be meaningful because we feel like we need to punish ourselves or feel a certain way or experience these negative feelings. And so I think there's two components here. I think the first component is real event OCD. How do we treat that from an ERP stance? Well, we treat it with ERP, right? So what it is being able to say, okay, like this event happened. Who knows what it means, or who knows if I could have done better, but I'm going to choose to, maybe there was some learning that could have happened or some things we do different in today's world. We want to be able to still have that conversation and speak realistically to that. We don't want to like totally ignore learning opportunities or things that we would change or shift in the future, and be able to acknowledge that and move forward, versus we acknowledge that or we see that, but we get stuck. And so getting stuck includes mental rumination, mental reviewing, trying to figure it out, trying to understand it, trying to make sure we feel good or okay about it. Instead, I want it to be like we acknowledge it. We acknowledge what we may have learned, if that's helpful, or if you haven't done that yet. If you've done it, I don't want you to do it again. So you do that once, right? There's no point in continuing to do that. But then you choose to move forward despite feeling uncomfortable or despite, right? But the other piece is sometimes we need to do some active ERP around that real event. So for example, some of our patients might get stuck around in that real event of like, I can't talk about it. I can't think about it if you bring it up, or if another topic gets brought up that makes me think about it, then I get stuck in rumination. Well, in that case, we need to actually like do some active exposures around that event. So talking about that event in a neutral stance, being able to write a script about it, being able to approach it, being able to address it, and not give in to rituals or rumination. So mental rituals or compulsions, and allowing that event to be and moving forward. So that's kind of how we address the real event triggers. As far as the guilt and all of that, I want you to be able to address ERP, but then when it triggers you and you start to feel the need to get pulled into this like negative self-talk, this guilt, this like as far away from self-compassion as you can imagine, I actually want the second piece of that exposure to be to engage in self-compassionate activities, right? So that might be behavioral activation things like going out and talking to a friend, reading a book, going on a walk, buying yourself a takeout lunch, right? Whatever it is that's like, okay, I'm going to address this situation and I'm going to do the opposite of what OCD wants me to do right now, which is engage in negative self-talk or negative behaviors that actually just make me feel even worse about both myself and the exposure. So we want exposures to actually feel good. They might feel hard and triggering in that moment, but they should bring you closer to your values. And so some of the things I'll have patients do is like, hey, I want you to do this exposure. And after you do it, I want you to intentionally say out loud what value that's bringing you closer to in your life, and then go do something around that. So for example, if in the morning I am getting really stuck and I'm engaging in a lot of, let's just say, contamination related compulsions. Yes, I'm going to do ERP where I'm going to choose to expose myself to those fears, and I'm going to not engage in compulsion. So I'm not going to ritualize. But then I might also add on a statement of like, I'm choosing not to ritualize right now, and this is really hard, but it's going to get me closer to being able to continue to maintain my job and have the life and career that I want. And so I'm going to head out and go straight to work. And then I get out of my house and go to work. So I'm like actually acknowledging why this exposure is really values-based to me and what it's bringing me closer to, right? So I'm sitting on the floor today, and this is like, man, sitting on the floor feels really triggering and makes me think I'm contaminated. I'm going to contaminate other people. And I'm choosing to do it because it's getting me closer to being able to enjoy being with my daughter when she's crawling on the floor and being around it, right? So how can we engage in ERP and practice self-compassion by acknowledging what the values are in our life that this is actually bringing us closer to, versus feeding into what OCD makes us think. Like OCD makes us think it's keeping us close to our values because we're staying clean or we're preventing harm or we're not contaminating. Those are false OCD fears or false OCD beliefs, right, that we want to tackle. So Chris, what do you have to add on to that?
Yeah, I think one of the things that was really life-changing for me when I was studying and researching kind of just OCD and stuff, one of the articles that came up to me, and it definitely made sense. It was talking about how the brain works with OCD and how it can be different from somebody without. And what's so difficult, let's say you have real event OCD, it makes sense, right? Let me go back in time. Let me analyze the situation. Let me kind of play by play. Let me run through it. Because in real life, the more time you spend on something, if I want to learn more about like seagulls, right? The more I read, the more I research, the more I look up, the more I think about it, the more clear I'll become. Unfortunately, that's not what happens in OCD checking. That's not what happens in hit and run OCD. That's not what happens in this subtype. The more that you try to replay the old event, the less clear and the less confident you are. So now if you're feeling low and not confident, the guilt comes in, the self-loathing comes in, and then OCD fills in those blanks. It says, well, you probably did, push that girl past the limits that she wanted when you were at her house sexually, or you probably were the one that was drunk driving and hit that person. And people will start to believe horrible things about themselves. And when I challenge it, I say, okay, well, the OCD is telling you did something pretty horrific. Why haven't you gone to the police? And they're like, well, I don't have any evidence it was me and all this stuff. And I'm like, okay, if you have no evidence, not good enough evidence to like make yourself right, turn yourself in, or to go apologize to the person or whatever, how are you letting that lack of evidence convince you that you are a person that deserves consistent guilt and consistent self-loathing? The OCD has tricked you into start doubting who you are as a person. So what we want to do, what we were talking about earlier when Liz and I were talking back and forth, is all the things Liz was just talking about. It sounds like it's going to make you worse. It's not. It's absolutely going to do the opposite. So when I work with a client that has past, real event OCD, as they start doing exposures, they do response prevention, they connect with values, etc. What they start to notice is like, wow, Chris, actually, the less I look and the less I ruminate and the less I'm in my head about it, I'm starting to feel more clear. And it's like, well, of course, because OCD isn't going to sit across from you and tell you how great you are. It's going to tell you how you deserve to be guilty and self-loathing. So I know the treatment sometimes sounds backwards, but it actually is going to get you to clarity. And then people will leave here and be like, wow, okay, I don't need to punish myself like I've been doing. That's the last thing I'll say. Don't forget that self-punishment is a big compulsion when it comes to real event OCD or false memory OCD. So people punishing themselves, not going out, not doing things because they feel so horrible.
So how do you address that? So if you are engaging in, or you have the urge to punish, and so maybe even for some people, the fear is like, well, I don't want to do this ritual. I don't want to not do this ritual because if I don't, then I'll have to punish myself. What would you say? How would I respond to that? What would ERP look like?
Yeah, so a real case, I worked with somebody who felt that they really, really was abusive to a pet, and I had zero doubt that she didn't do it. She was like the biggest pet lover, and that's what's always, how Liz and I and other therapists feel is you all come into our sessions and you guys are the most amazing people, but your brain is telling you the opposite, right? So when I asked about the punishment, the client didn't let themselves have a pet. They didn't go to like a shelter and play with pets. They wouldn't let themselves watch movies with pets, not because it brought up thoughts, because sometimes people avoid those things because it brings up intrusive thoughts, but the guilt and self-loathing made her not feel worthy enough to be around pets. She wouldn't let herself pet pets. She was younger and she liked pets. So she'd punish herself. She's like, I'm never going to let myself be around pets or be around animals because I don't deserve it. I hurt my pet, I think. I'm a terrible person. And then it would bleed into other things. Like I remember not this client, another client wouldn't get avocado on their Chipotle. And it sounds silly, but they were just like, I'm a horrible person that might have done something sexually to somebody. How dare I get avocado? I don't even deserve stuff like that. So it sounds silly as ERP, but let's go do things that are fun. Let's go do things and celebrate things. And it sounds like, well, how is that treatment? For those clients that are really punishing themselves, it was tough, man. I mean, it was tough for her to even get a t-shirt with a pet and to call herself a pet lover on social media. It was hard for my client to like get, he really liked a certain drink. So like going and getting a drink and getting guacamole, it sounds silly, but in their minds and the way that OCD kind of conceptualized it for them is like, why are you a bad person? And then treating yourself with something you enjoy. You need to be at home, bare minimum, strip down and punish yourself. And so for them, celebrating themselves was difficult, but it works.
Meanwhile, now all I can think about is how I really would like some chips and guacamole. So somebody could help me. This would be great. But no, it's so true. So it's interesting because we have this conversation a lot here where a lot of people, I want to give a quick background. So BA is called behavioral activation. And this is an intervention that's often used for depression, right? So this thought process of like the biggest way to fight depression, which, you know, the way depression is breeded or like kind of increased is isolation, right? Kind of avoidance of enjoyable activities, is we want you to go do the opposite. We want you to get out of your house. We want you to go do enjoyable things, even when you don't feel like it. And so BA is about, and that's when it's most important, right? It's not about BA in general. It's about doing BA when we don't feel up for BA, right? When we don't feel like doing it. Those are the really important times that it makes sense to definitely go do it. And it's interesting because one of the questions I get a lot, Chris, I don't know if you do too, is like, how do I know if I'm engaging in BA effectively or if I'm engaging in BA to distract myself from OCD?
Big question.
And so the thing I always tell patients is like, again, what is the function of it? If the function is, oh, I'm going to hurry up and go do this activity that I enjoy, or I'm going to hurry up and get on my phone or like scroll Instagram because I don't want to think about this thought, and we're doing it to be able to try to like push a thought down and like avoid, then it's not helpful, right? You're using it to distract yourself. But instead, if you're engaging in BA because it's an enjoyable activity and you're actually able to like, so with that being said, for many patients, BA is an exposure, because again, if doing the BA feels difficult, or it feels like, well, I don't deserve to do that, or I don't know if I should do that, or I shouldn't do that, more the reason you should absolutely be doing that, right? So again, it's kind of that piece of like, what is the function? If the function of BA feels like it's to avoid, then it's probably not helpful, at least not yet. I want you to lean in first, then go do BA. But if BA as a function, it feels even more difficult, or it feels like it's hard, or that you don't think you should do it, that's more the reason you should do it. And so there's times we have patients here at our clinic where like literally during ERP blocks, they're playing video games, they're doing these things, they're going on walks, and some of our staff will be like, hey, like, are they doing ERP, or are they like avoiding ERP? And it's like, no, that is their ERP, right? Because for some of our patients, doing things that are enjoyable doesn't feel productive, or feels like they don't deserve it. And so that's more the reason why I want them doing that, you know? So yeah, important to think about what's the function, right?
And I think for people, because a lot of us, I know I got diagnosed as well with major depressive disorder. A lot of individuals with OCD are also experiencing depression. And because behavioral activation is so effective for depression, you're going to have to do it. And that's a question I get from clients as well. It's like, behavioral activation is really helpful for me with depression. And how do I make sure I do it without it being a distraction? And one thing I'll say is like, okay, maybe when you work out, you don't think about OCD as much. That's not a bad thing. It doesn't mean you should quit working out, especially if that activation absolutely helps your well-being and mental health. But just don't schedule your workout directly after an exposure for the sole purpose of calming your brain. If you want to work out every day at 4, work out at 4. Awesome.
Yeah.
You know?
Yeah, exactly right. And again, if it feels like you're getting rigid, then practice flexibility, right? So if it's like, well, I don't know, should I not? Or you're getting stuck in it, just go do it, right? Again, this is about, we don't want perfection. We don't, right? We just want you living life. Like if it feels like something that's valuable to do, great. But if you're doing it to avoid thinking about something or to avoid certain distress, lean in first and then still go do that enjoyable thing. It doesn't mean you can't do that enjoyable thing. Next question that is great is, how do I allow and overcome religious intrusive experiences without feeling like I'm acting against my values?
Yeah, I mean, I work with clients with scrupulosity, and one of the things that I always think about is how sad OCD is, right? Like, what I'm so sad about is I'm sitting across from somebody who loves their faith, they love their God, they talk about some of their favorite memories in church, or they've met their partner in church and things like that. And one of the things that I do sometimes with clients that I think is really effective in the first couple sessions is I do a how did we get here timeline. I literally have a big whiteboard and I kind of write out like, how did we get here? Because I think for people with OCD, it feels like it just happened overnight. But when we look at it, and one of the effective things that sometimes clients will see is they're like, wait a second, as my OCD, my mental compulsions and physical compulsions increased, my connection with God has gone down. That is not a coincidence. The OCD's job is it presents like snake oil and tells you that the more compulsions you do, or the more avoidances you do, the reassurance, etc., you're going to get more pure, more scrupulous, more close with God, right? And what ends up happening when people do the timeline, it is very clear that the more they gave into OCD, the further they are from their faith. So I have that conversation and say, hey, Do you recognize that you have been less connected with your faith and become more connected with the OCD? Because those two things are really difficult to coexist. The other thing I sometimes do with clients, especially when it's a faith I'm not as familiar with, is I don't think it's bad one time. We don't want it reassurance wise to meet with a religious figure you look up to, a pastor, a priest, a rabbi, etc. Because a lot of people have misconceptions about their faith. I'll have clients that come in and say, oh, I'm supposed to never have a bad thought. That's what I read in the Bible. Or, oh, I'm supposed to be praying 6 times a day for an hour each. And then they find out that that's not that. So that can kind of help us guide. But finally, what I'll say before I toss it to Liz, and what Liz and I have always been trying to say recently, and I think beyond recently, but especially recently, is if you're going in and working with a clinician who is having you go past your comfort zone, and your comfort zone is going to be different for everybody. So I've had clients come to me and say, I used to work with this therapist, but I moved, and what was most effective for me is like writing bad words in a book while I'm in church. I'm not going to suggest that because I think that you don't have to do that to get better. But if that's what a client wants, that's how the flexibility happens. But typically the route that I normally take, unless a client is very clear on what they want, I create values-based exposure. So an example is like, I'll ask a client, like, when's the last time I was working with a young adult recently that had this same fear. When's the last time you went to your young adult youth group? You said that was one of your favorite things. When's the last time? Okay, it's been 7 months. Maybe you're not ready to go back because you get triggered there. But what about this Wednesday? What if you just sit in the parking lot? You bring a book, you bring some food, you just kind of hang out and just look at the room. And then they moved up and got in there. And then you're going to have thoughts when you're in there. But you have a choice. You can direct yourself to the OCD and have a conversation with OCD for the hour and a half during church, or you can engage with everybody and choose to let OCD say what it's going to say, but disengage with that. So the treatment should make you feel closer to your faith, not further away. And it should be values-based, and it should be something that you're comfortable with and not fear factor just to shock you.
Yeah. So I always tell people that I think the misconception of scrupulosity, just like the misconception that we started with today of any OCD, is that, oh, like, I'm never going to have clarity, or like, hey, like, you want me to just be okay with not feeling good about my faith, or you want me to be okay with not knowing if I'm going to go to heaven, or not knowing if I've offended God. That is not the goal of treatment. Like, the goal of treatment is that we actually just remove OCD, and you will have more clarity and a healthier, more fulfilling faith relationship, right? It's going to bring you closer to who you want to be, or the faith that you want to have, versus further away. And I always want to be really clear about that, because I think, like any OCD, it's this misconception of like, oh, you want me to accept that I'll never know if I'm a pedophile. Like, no, like, that's not the goal of treatment. The goal of treatment is that you're going to be able to understand you're not a pedophile, but also we have to lean into the fear because OCD has taken that clarity from you, right? So we're going to help give you that clarity back. We are going to help give you more clarity about your faith, or you're going to actually be able to obtain more clarity about your faith. We're not going to give it to you. You're going to give it to yourself by removing the OCD. But it 100% should be values-based. We should never be asking you to do something that you wouldn't be comfortable doing, right? So like Jeff gave a great example of this once, Chris, where he was talking about when he worked in Boston, like there was a time where someone went and did exposures and the patient had scrupulosity, and the exposure turned into like throwing rocks at the church. And that Jeff was like, well, why did they throw rocks at the church? Like, was that something that they wanted to do? And like, they felt like that was a good idea. And the person was just like, no, like, I just thought that made sense because they had scrupulosity. And it's like, wait a second, like, we don't just make guesses or assumptions at what we think would be a good exposure. You should drive that exposure, right? What are the things you want to get back to? What are the things you're avoiding? What are the things your OCD is taken away from? We want taking you away from. We want you to get back to that, but we teach you skills of how to do ERP while you're getting closer to the life you want to be living. That's the important piece.
Quick shout out to Katie O'Dunn. Don't forget that we have live streams that are faith-based that she has. I believe it's every other month, opposite of Diversity Roundtable. So definitely check out the live streams. They're going to be Tuesday evenings at 7 p.m. Eastern, 4 p.m. my time here on the West Coast. Katie O'Dunn hosts every other month, I believe it is, a faith-based live stream. And there's our Faith and OCD conference that comes up. I believe it's around May each year because it's always near my birthday. So I think that there's some really good stuff out there for people specifically dealing with scrupulosity.
Totally. Next question that we will jump to is, my drinking stops me from going to therapy because I know they'll say it is all that I drink, and I won't end up getting the OCD therapy needed, which is the cause of my drinking. So we get this question a lot, is like, hey, like I'm struggling with drinking. We also see this for like self-harm or other things of like, hey, but my OCD is what causes me to drink. My OCD is why I self-harm, but I need to have stability from self-harm or from drinking first. Like, what do I do? How do I navigate this? So I can take this on too, but Chris, why don't you hop in first?
Yeah, I'd say that's the biggest difficulty with this one is because, obviously if somebody's coming to treatment really drunk or alcohol is preventing somebody from getting treatment, it's difficult. And for a therapist or a center that isn't prepared or isn't trained to work with someone, because some people aren't, right? They don't specialize in working with substance use disorder. And so that therapist may not feel equipped. But the good thing is we don't want to always force people and say you have to get sober if the whole reason they're drinking is OCD. So always remember you can have a collaboration of care. There's some centers that specifically work with both. But I would also say that like where I live, Orange County has the most rehabilitation centers and substance use centers per capita in the United States. And so I have a lot of clients that are dealing with whether it's marijuana, whether it's drinking, et cetera, and working with someone there and working co-occurrently with me. And that for me, because I do have a lot of training in substance use, I'm sober myself, and I feel confident if the client is not in a dangerous position. But if somebody is really struggling to even get out of the house because of drinking, they need a higher level of care. But we work in tandem, and what clients will report is they get a lot of helpful skills there of how to reduce the drinking and to get to a point that they need to be with that. And then working on the OCD is help dissipating the reason that they're drinking in the first place. And the combination really helps. So either a collaboration of care, sometimes a center will have both providers working together, or a clinician feels confident with both.
Yeah, so I just want to add on that, yes, to all. And learning can't happen if you're not sober. Learning also cannot happen if you are a danger to yourself, because safety comes first, sobriety comes first. So I do want to be very clear that like most of us are going to have a hard and fast rule that if you're not able to be sober, we can't engage in ERP with you. And the reason for that is like learning can't happen. So it's not that we're saying, we're not debating or doubting that you may be drinking because of the OCD, but we can't address the OCD if the drinking isn't handled first, right? If your safety's at risk, we can't jump into OCD work because safety is a bigger priority. So there's this kind of like, it's kind of like, oh, Chris, I'm going to throw more work at us. We should create like Maslow's hierarchy of needs for like, Maslow's like hierarchy of OCD treatment, right? But like it'll be Trondsen and McIngvale's hierarchy, right? But it's like what comes first, right? Like, and we talk a lot about this is that if your emotion regulation skills are so poor that every time you get triggered or every time you feel high levels of distress, you self-harm or you engage in violence or whatever, there's this like big reaction. We 100% have to address that first, because guess what? ERP is going to dysregulate you. The way ERP treatment works is it dysregulates you during the process of recovery. But if when you're dysregulated, you can't maintain safety, or if when you're dysregulated, you're going to go drink, we are not going to make progress. So ERP is going to be unsuccessful and sobriety is going to be unsuccessful. And so it's really important that you're working with someone who is a specialist who can help guide you in that. And it is not treatment centers like mine and others that require sobriety. It doesn't mean we don't work with people co-occurring, but that is not our specialty. And so at the end of the day, if you could leave my treatment program at 4 p.m. and you're going to go drink or you're going to go engage in any sort of, self-harm behaviors, you're going to be discharged, and then you're going to be upset that it feels like ERP treatment didn't work. And so this is where a team approach is just so critical. We cannot treat one without the other and vice versa. So we would want to kind of start slow. Our first step would be to get you sober and to start getting you into ERP, and then to maintain ERP treatment while you maintain sobriety. So it's really important to know where that's coming from and why, right? So it's number one, like there's just a hierarchy of what has to be managed first. But also, if it's not managed first, can ERP even happen, right? Like the process of ERP requires learning to be able to take place. It requires you to be able to be dysregulated and to be able to manage your way through that dysregulation. And so we want to set you up for ERP being as successful as possible.
Well said. And I'm glad that you added that it's not like we don't want to work with people. It's just we want you to be in a place where you get the most from it. And research, just like Liz said, you can't learn when you're high. You can't learn when you're under under the influence. And so the hard thing is, it's not that we're trying to be cruel. It's just saying we don't want you to put all that time and energy in the work. But that doesn't mean that you can't get treatment. Just do a team approach. I know that sometimes it's difficult to find two providers, but I promise you that's what everybody does that gets better, because they are able to address both.
That's right. Yeah. So wonderful live stream. It is 1 o'clock, so I want to be cognizant of time. It goes so fast as always, but we will continue to note questions. And of course, our future ones, we'll continue to answer them just like we did today. But we love seeing you guys. It is so great to have this community, to have each other, and to hopefully be able to provide some support and education that you're looking for. Please don't forget to go to iocdf.org/peace of mind and let us know if you want different content, different stuff, so that we can make sure we are addressing your needs versus anyone else's. Thank y'all for joining. Chris, I'll let you wrap up. Remember, help and hope are always available.
Yeah, a couple final thoughts. Felice, I see your question about Tourette OCD. It's on the top of the questions. Liz and I will be back next Wednesday. I believe that's the 2nd, if I'm right on the top of my head. That's going to be Ask the Expert, so we're going to get to more questions. So Felice, come back, we'll answer that. We're talking to Allegra, we're talking to Michelle Massey, and we're talking to John Hirschfield to get them on the streams, because we have some great content with them. Lastly, all I want to do is shout out to Nikki Bratley, who wrote an amazing comment in the chat that she's turned her life around. She's in the process of doing it. She's doing ERP for contamination and her hoarding. She is turning 60 the day of Ethan and Katie's wedding, and she's looking forward to starting your new life. That warms my freaking heart. Val talks about it all the time. You are never too late to get treatment. I love this for you, Nikki. I'm so proud of you that you're putting in the work. You're getting better. You are still so young. You have so much life. And when I am at Ethan and Katie's wedding, I will also be thinking about you turning 60 and having that turned around. So you heard some hope from Liz and I, but we also hear hope from the community, and that's amazing. Come back and see us goofballs next Wednesday, 9 a.m. Pacific time, 12 Eastern. Love you guys. Take care. Have a great rest of your day. Kick OCD's butt.